Hello everyone, welcome to my class to learn about elderly care. As is known to all, population aging has become a common social problem in countries around the world. Faced with a large elderly population, the corresponding healthcare services have become increasingly important. Different countries have different age classification standards for the elderly. Developed countries such as those in Europe and America regard people over 65 years old as the elderly. Developing countries, especially in the Asia-Pacific region, refer to people over 60 years old as the elderly. According to the actual situation in China, the Geriatric Society of the Chinese Medical Association suggests that people over 60 years old should be defined as the elderly. In order to provide effective health care for the elderly, we must first understand the elderly, and then take targeted care measures according to their characteristics. The course Elderly Healthcare includes the following topics. 1. Physiological and psychological characteristics of the elderly. 2. Elderly-friendly environment arrangement. 3. Daily life care for the elderly. 4. Care for common diseases of the elderly. 5. Emergency first aid techniques. 6. Hospice care. In this class, we will first learn about the physiological characteristics of the elderly. Aging is an inevitable natural process of life. In the life process, after growth and development reach maturity, the body's morphological structure and physiological functions undergo a series of degenerative changes. First, characteristics of the motor system. With reduced exercise, aging, and degenerative changes, muscles gradually atrophy and their elasticity decreases. Muscle strength weakens, making people prone to fatigue, sprains, and soreness in the waist and legs. The organic matter in bones decreases or degenerates, leading to osteoporosis, increasing the risk of fractures. Ligaments harden, joint capsule connective tissue proliferates and becomes fibrotic, resulting in joint stiffness and inflexible movement. Second, characteristics of the respiratory system. The elasticity of the respiratory tract, such as the trachea, decreases and their functionality weakens, and the functions of secretion and foreign body removal decrease. The respiratory muscles, diaphragm, and ligaments of the elderly atrophy. Costal cartilage calcifies, which weakens the respiratory function of the lungs and reduces vital capacity, making it easy to experience shortness of breath, difficulty in gas exchange, and irregular breathing rhythm. In addition, due to the decline of respiratory function, the reflex cough function weakens. Tracheal secretions are difficult to expel, causing the elderly to be prone to respiratory diseases such as lung infections and obstructive pulmonary diseases. Third, characteristics of the digestive system. The most obvious changes in the digestive system are loose and missing teeth, which affect eating. The peristalsis of the digestive tract, such as the stomach and intestines, slows down, and gastric emptying is delayed. The secretory function of digestive glands weakens, and the amount of various digestive juices decreases, leading to weakened digestive function, increasing the likelihood of digestive disorders such as indigestion, impaired nutrient absorption, and constipation. Fourth, characteristics of the circulatory system. The myocardium of the elderly undergoes degenerative changes. Epicardial fat increases, endocardium thickens, myocardial contractility weakens, the number of pacemaker cells in the sinoatrial node decreases. Changes in heart rate and rhythm often occur. The cardiac output of the elderly is 30–40% lower than that of young people, and their reserve capacity is small, which slows down the heart rate of the elderly and makes them prone to premature beats, atrial fibrillation, conduction block, etc. In addition, arterial sclerosis causes decreased arterial elasticity and narrow vascular lumen, increasing the resistance of blood flow and leading to increased blood pressure. At the same time, due to the narrowing of the coronary artery diameter, the blood supply to the heart itself decreases, resulting in insufficient blood supply to the heart and the occurrence of coronary heart disease. Also, due to unstable autonomic nerve function and poor vascular regulation function, making them prone to orthostatic hypotension. The capillaries of the elderly become brittle, and the elasticity of veins decreases, making venous return difficult, thus easily causing problems such as subcutaneous hemorrhage, thrombosis, lower limb swelling, and hemorrhoids. Fifth, characteristics of the nervous system. With the increase of age, the brain tissue of the elderly gradually atrophies, and the nervous system undergoes progressive decline, which reduces the elderly's ability to respond to external things, makes them insensitive to cold and heat stimuli and slow to respond to pain, so the symptoms of some diseases may not be detected in a timely manner. The elderly's nerve cells atrophy and their number decreases, leading to slow movement, decreased balance, and uncoordinated limbs, and the responses of some protective reflexes are also relatively slow. Sixth, characteristics of the urinary system. The renal blood vessels of the elderly undergo sclerosis and the lumen narrows, resulting in reduced effective renal blood flow and decreased glomerular filtration rate. The reabsorption function of renal tubules decreases. The regulatory function for water and electrolytes declines, making the elderly prone to water and electrolyte disorders. The bladder capacity of the elderly decreases, and bladder muscles atrophy. The contractile ability for urination weakens, and the residual urine volume in the bladder increases, increasing the frequency of urination in the elderly, especially at night, and making them prone to urinary urgency and even urinary incontinence. Elderly men, due to benign prostatic hyperplasia, sometimes experience difficulty in urination, which may lead to urinary retention. Elderly women, due to a short urethra, urethral muscle atrophy, and poor sphincter contraction, are prone to stress urinary incontinence and urinary tract infections. Seventh, characteristics of the reproductive system. The secretion of sex hormones in women gradually decreases after the age of 40, and they enter menopause and stop ovulation around the age of 45 to 50. After menopause, the fallopian tubes, ovaries, uterus, and vaginal mucosa begin to atrophy. The vaginal wall becomes thinner, the function of vaginal glands weakens, and secretions decrease, leading to vaginal dryness and itching, and the ability to resist bacterial infections decreases, increasing susceptibility to infections. Due to the decrease in sex hormone levels, a series of menopausal symptoms may occur, such as irritability, suspiciousness, night sweats, palpitations, etc. Andropause, male menopause, occurs around the age of 55 to 60, and personality changes may also occur. Eighth, characteristics of the endocrine system. During the aging process, the synthesis and secretion of thyroid hormones and thyroid-stimulating hormone decrease, leading to hypothyroidism. In addition, the biological activity of insulin in the elderly is significantly reduced, making them prone to diabetes. Ninth, characteristics of the sensory organs. In addition to the slower responses to external stimuli caused by nervous system decline, changes in sensory organs also reduce the elderly's response to the outside world. The main manifestations are as follows. 1. Visual impairment. Due to lacrimal gland atrophy, dry eyes, and loss of lens elasticity, the elderly's ocular accommodation decreases, leading to presbyopia, which causes blurred vision, especially for near objects. In addition, the elderly are prone to cataracts, narrowed visual fields, and weakened pupillary light reflex. 2. Hearing impairment. Due to hearing impairment, the elderly cannot hear others clearly, often give irrelevant responses or mishear and misunderstand others' meanings. Over time, they are unwilling to communicate with others, thus becoming isolated and slower in response, or developing psychological issues such as hypersensitivity and suspiciousness, which brings inconvenience to life and social activities. 3. Diminished skin sensation. The ability to feel cold and heat decreases, making them prone to low-temperature burns. Skin pigmentation increases, and age spots appear. 4. Taste changes. Due to thickened tongue coating, reduced taste buds, and weakened saliva secretion, their sense of taste is greatly reduced, and they prefer sweet and salty foods, which is not conducive to health. These are the physiological characteristics of the elderly. In the next class, we will learn about the psychological characteristics of the elderly.